What is convalescent plasma therapy? Now, convalescent plasma is plasma taken from a convalescing patient. What is a convalescing patient? Somebody who has gotten better after having had COVID infection. And what is plasma? Plasma is part of the blood that remains after you remove the red cells from it. Plasma is rich in antibodies, which are protective substances against COVID. How does convalescent plasma therapy works? What happens is, when somebody has COVID infection and they recover from it, they have a permanent antibody response, which is a immune response, so that they don't get reinfected. So what we do is we take out the antibodies which mediate this immune response and give it to a patient with severe COVID disease who has not yet formed antibodies, or whose antibodies are not good enough in order to kill off the virus and help them get better. Plasma therapy and COVID-19. This is a subject of ongoing investigation. There have been roughly about 15 patients published in the literature from China and a few more from the US, which is as yet unpublished, who seem to have recovered when you gave them this plasma therapy. In fact, all the patients who got the plasma therapy improved. We don't know whether they got better because of the plasma therapy or they got better on their own, because of their own immune system finally clearing the virus. They all stayed in the hospital for long periods of time, but it is a therapy in which all patients who have received it so far seem to have gotten better. So it is a promising therapy which is being tried out right now. Who all are eligible for this plasma therapy? We typically would like to use plasma therapy in a patient who has severe COVID infection. And the reason for that is patients with mild and moderate COVID infection get better on their own. Their immune systems are strong enough to clear this. It is only those who have severe infections that you need help in the form of antibodies to help them clear this infection. So typically, somebody who's in an ICU, whose oxygen levels are very low, is a candidate for this kind of treatment. Effects on the immune system. The plasma therapy itself is kind of an immune booster. It gives you pre-made immunity against the COVID. In itself, it does not have major effects on the immune system. So side effects are not a great concern with plasma therapy. We always look at whether the blood groups are compatible before taking plasma from somebody and giving it to a recipient. Is plasma therapy a good option for all viral infections? Now it depends on the viral infection. For certain viral infections like influenza, we have good antiviral drugs like say oseltamivir. So we don't need plasma therapy. Where plasma therapy is upcoming or good or has been used is in those viral infections which are new to science. So we have not been able to devise antiviral drugs against them, or which are rapidly fatal. Typical examples are the ongoing Ebola epidemic in Africa and the previous MERS, Middle East Respiratory Syndrome, seen in the Middle East. You still have cases there. So these are all emerging viruses for which no good antivirals are available or antivirals have not worked. So convalescent plasma is useful in those situations. Treatment cost. Now it is anticipated that the cost of plasma therapy will not be as high as the cost of some of the drugs we use to treat COVID. Some of these drugs are under patent, they are very expensive, whereas plasma therapy is like a blood transfusion almost. So it is anticipated that the cost will not be very high, and most Indian private and public hospital systems should be able to afford this. The duration of treatment is actually quite short. It's like getting a small mini blood transfusion. You typically infuse about 200 to 250 ml, and then you repeat another 200 to 250 ml as required depending upon the protocol they follow. It's like a mini blood transfusion or getting an IV drip over a period of a few hours. So the treatment procedure also is not at all complicated. It does not involve any major procedures for the patient. It's just like giving an IV medication or a blood transfusion, which is actually quite a common event. Thank you.